Good morning, everyone. Sorry for the delay, but appreciate your patience. All right, one moment. Welcome to the April 9th, 2025 Legislation and Regulation Committee meeting. My name is Jessica Crowley, chairperson of the committee. Before we convene, I would like to remind everyone present that the board is a consumer protection agency charged with administering and enforcing pharmacy law. Where protection of the public is inconsistent with other interests sought to be promoted, the protection of the public shall be paramount. As I facilitate this meeting, I will announce when we are accepting public comment. I have advised the meeting moderator to allot 3 minutes to each individual providing comments. We will begin with public comments for individuals attending in person, followed by public comments by individuals participating via WebEx. This approach is necessary to facilitate this meeting. Before we get started, I would like to ask staff moderating the meeting to provide general instructions on the process for providing public comment via WebEx.
Thank you. This is the moderator. At appropriate times, we will announce that we are open for public comment. At that time, we will display instructions on the screen, and people who would like to make a comment can look for the hand icon, which is typically at the bottom of your WebEx screen if you're on a computer. If you're on a mobile device, it might be behind the 3-dot other options button. And if you are a call-in user, you may press *3 to raise your hand. As stated, each person will have 3 minutes to comment with a 10-second warning. We ask people to stay on topic, and we ask that people speak only once per agenda item. Those are the instructions. Thank you.
Thank you very much. I would now like to take a roll call to establish a quorum. Trevor Chandler.
Public member present.
Thank you. KK Jha. I think he may be coming later. Do we know? We'll see. Maria Serpa.
Licensee member present.
Thank you. Nicole Tebow.
Licensee member present, and there is no persons 18 years or older present with me at this time.
Thank you. And I'm here as well. A quorum has been established. Members, we have a full agenda for our meeting today. I ask everyone participating to be respectful of the work before the committee. We encourage participation by members of the public throughout our meetings at appropriate times. The committee respectfully requests that when comments are provided, they are done so in a professional manner consistent with how the committee conducts its business. Finally, before we move to the next agenda item, I'd like to remind committee members participating via WebEx to please remain visible on camera throughout the open portion of today's meeting. Members, if you need to temporarily turn off your camera due to challenges with internet connectivity, please remember to announce the reason for your non-appearance when you turn off your camera. Agenda item 2, public comment on items not on the agenda or agenda items for future meetings. I will now ask the moderator to open the line for individuals to provide the opportunity to provide public comment. You are not required to identify yourself, but you may do so. I'd like to remind everyone that the committee cannot take action on these items except to decide whether to place them on a future agenda. Members, following review of public comments for this agenda item, I will ask members to comment on what, if any, items should be placed on a future agenda. As a reminder, this agenda item is not intended to be a discussion, but rather an opportunity for members of the committee and members of the public to request consideration of an item for future placement on an agenda, at which time discussion may occur. Are there any members of the public in Sacramento that wish to provide public comment for items not on the agenda? Seeing none, moderator, we are ready for public comment from individuals participating via WebEx.
Thank you. If anyone on WebEx would like to make a suggestion for a future agenda item or call out something that's not already on the agenda, you can look for the hand icon and click that to raise your hand. As a reminder, call-in users may press *3 to raise their hands. Each person will have 3 minutes with a 10-second warning, and we ask you to speak only once per agenda item. I do not see any requests for public comment at this time. Shall I close the public comment feature?
Yes, please. Thank you.
You're welcome.
I will now bring the discussion back to members. Well, we'll move on to the next item, actually, since we don't have any public comment. Agenda item 3, approval of the July 17th, 2024 committee meeting minutes. Members, as we begin our consideration, I will ask if members have questions or comments on the draft minutes from July 17th, 2024. I will also entertain a motion if you believe such action is appropriate.
Move to pass.
Thank you. Members, do we have a second?
I was looking for someone else to take the pleasure of seconding.
Thank you, Maria. With a motion and a second on the floor, we do have Nicole here too. I will open the discussion for public comment on the July 17th, 2024 draft minutes. Are there any members of the public in Sacramento that have public comments? Being none, moderator, we are ready for public comment from individuals participating via WebEx.
Thank you. If anyone would like to make a comment on the first set of minutes, you may look for the hand icon and click that to raise your hand. Or you may, if you're a call-in user, you may press *3 to raise your hand. Are there any comments on the minutes? I do not see any requests for comment. Shall I close that feature?
Yes, please. I'll now
Thank you.
bring it back to members for the vote. Trevor Chandler?
Yes.
Thank you. Maria Serpa?
Yes.
Thank you. Nicole Tebow?
Yes.
Thank you. And I vote yes, the motion passes. Agenda item 4, discussion and consideration of pending legislation impacting the practice of pharmacy, the board's jurisdiction, or board operations. Members, there are a number of measures included on the agenda today for our discussion. February 21st, 2025 was the last day for bills to be introduced. The next legislative deadlines include May 2nd as the last day for policy committees to hear and report to fiscal committees bills keyed as fiscal, and May 9th as the last day for policy committees to hear and report to the floor on non-fiscal bills. I'm highlighting these deadlines as I believe it is important to note that the legislature is very early in the legislative cycle. Given our next meeting is scheduled for June 11th, it may be appropriate to watch some measures at this time rather than establishing a position to allow us to monitor measures through at least the first policy committee hearings. The meeting agenda and materials identify pending measures impacting the practice of pharmacy, the board's jurisdiction or board operation that were identified during the development of the agenda for this meeting. As pending legislation is dynamic, measures may be amended to subsequently impact the board or its licensees, but may not appear on our agenda. For example, Assembly Bill 1366 was amended on March 28th, the same day as the release of the agenda, and as such, this measure is not included on our agenda and cannot be discussed. Members, do you have any questions or comments before we proceed?
Just one question again. Sorry about the process end of things. There's one bill, SB 40, which was regarding capping insulin costs. I was wondering if that was possible to include or if that is outside of our jurisdiction to discuss.
Because it's not included on the agenda, we cannot discuss it today, but we can make a note to add it to the agenda for June 11th.
Awesome. Yes. If we could add that, I'd be very interested in getting the board's support for that.
Thank you.
Thank you. Any comments, Nicole, or questions? Great, thank you. The first measure for our consideration is Assembly Bill 50. Members, this measure would update provisions related to pharmacist-furnished hormonal contraception to explicitly allow pharmacists to furnish over-the-counter contraception without following the standardized procedures required for prescription-only hormonal contraception. Further, the measure would allow for the furnishing of up to a 12-month supply at one time of an over-the-counter contraception. The measure successfully passed out of Assembly Business and Professions Committee with 17 votes in support and 1 abstention. I agree with the staff recommendation to support the measure and note it is consistent with the board's sunset issue related to hormonal contraception. Members, I welcome your thoughts on the measure and would also entertain a motion to recommend establishing a position on the measure if you believe such action is appropriate.
Just want to quick comment saying I think this bill is more important than ever in our current climate, and the more that California can do to establish ourselves as a leader in ensuring ease of access to contraception that we should take. And so I move to accept the recommended position of support for Assembly Bill 50.
Great. Thank you so much, Trevor. Do we have a second?
This is Nicole. I'll second.
Great. Thank you. With a motion and a second on the floor, we are ready for public comment in Sacramento. And it's seeing none. Moderator, we're ready for public comment from individuals participating via WebEx.
Thank you. If you would like to make a comment on Assembly Bill 50, the contraceptives, you can look for the hand icon and click that to raise your hand. And our call-in users may press *3 to raise their hand. Each speaker will have 3 minutes with a 10-second warning, and we ask people to speak only once per agenda item. We have a request for comment from Keith Yoshizuka. I'm going to send you a request to unmute your mic, and we'll have 3 minutes. You're unmuted. Go ahead.
Some pharmacists. I'm pleased to state our position of supporting this measure for the reasons stated. Thank you.
Thank you so much for your comments.
Thank you. And I do not see any further requests for comment. Shall I close the public comment feature?
Yes, thank you. And it looks like we do have one public comment in Sacramento.
I'm afraid we're going to have to ask you to use your microphone because WebEx can't hear you.
Yeah,
Thank
I
you.
haven't been here in a while, so I forgot how these work. Hi, Michelle Rivas with the Pharmacists Association. We're also in support of the bill. Thank you.
Thank you. Perfect. I don't think we have any additional comment in Sacramento. Moderator, do we have any additional public comment via WebEx?
No, we do not.
Perfect. I will bring it back to members for a roll call vote. Trevor, how do you vote?
Yes.
Thank you, Maria.
Yes.
Thank you, Nicole.
Yes.
Thank you. And I vote yes. The motion passes. Members, the next bill we have is Assembly Bill 447, which would allow a prescriber to dispense an unused portion of a dangerous drug acquired by the hospital pharmacy to an emergency room patient under specified conditions, including the dangerous drug is not a controlled substance, the dangerous drug has been ordered and administered to the emergency room patient, and dispensing the unused portion of this dangerous drug is required to continue treatment for the patient. Further, as amended, it would exempt from licensure an AUDS that is used to dispense an emergency room patient pursuant to Business and Profession Code Section 4068. I'm sorry. Members, I believe this is a good example of a measure I believe we should watch. The measure was considered in Assembly Business and Professions Committee yesterday, and it is my understanding that the measure passed out of committee with additional amendments to that measure, but those amendments are not yet in print. While I am generally in support of this measure, I am concerned with the provisions of the measure related to exempting ADDS from licensure as proposed, and would be interested in hearing from members about the challenges hospital pharmacists may experience when healthcare providers access to pharmacy stock, but do not comply with the provisions of pharmacy law. So members, I welcome your comments. Probably looking at you, Maria.
Yeah, thank you. I have a lot to say on this. This has actually, been my life for a couple of decades. The issue is real in that we have patients who come into an emergency room and often have trouble accessing their post emergency room visit medications. And so trying to assist them is a valid issue. The other issue that this really talks about is unused medications, unused portion of the dangerous drug. I think that needs to be further developed to understand what that means, because on the by looking at it at first blush, it looks like it means where we have a challenge with inhalers, creams, and ointments. That's a very common thing that you want to be able to send home with the patient. Obviously, they've used it. It's now contaminated. You can't use it on another patient. You throw it away. They're just going to go home trying to get a refill or get a prescription someplace else. That's a valid thing that the patient needs. The concern comes with having it be appropriately labeled and having all the information that the patient needs, and that it be documented that it was dispensed to the patient by the pharmacy. I think one thing that people may not be familiar with is that the medications in the emergency room are under the responsibility of the pharmacy. Those medications are still in the pharmacy's inventory. We had this similar discussion when we talked about controlled substances and the 72-hour supply, and it has to deal with the whole discussion of prescriber dispensing in the emergency room. It is a very complex issue. Unfortunately, things always get more complicated than they need to be. So I agree with the position of WATCH. I think that this is an important issue that has to do with patient access and care, but need to make sure that the pharmacy at the emergency room facility, hospital, acute care facility is aware, has documentation, and that the medications be appropriately labeled. Unfortunately, during my career in acute care pharmacy, I have seen many, many times where healthcare providers hand medications to patients without appropriate labeling, and then they also don't know if that medication is found later, where they got it. It doesn't even say the name of the hospital, the facility. There's a lot of details that are important, but can be easily done. Most acute care facilities have a process for unused medications already. So I'm not quite sure what they're trying to get at. Most acute care facilities have a process to either label the medication like an inhaler in the emergency room, or they send it to the pharmacy and get what they call as a relabel. Those do cause sometimes delays, and maybe that's the issue, that you have to wait maybe up an hour for that relabel to be done. So I agree with the position of WATCH. Long story, but I know a lot about this practice, and there are some pitfalls if it's not done correctly.
Thank you so much for that detail. That definitely helps to bring things in perspective a lot more.
I didn't speak to the AUDS licensure.
Oh, yes, thank you.
Sorry. That one I'm not, might be surprised. In acute care facilities, the AUDS is already exempt from licensure. The only exception is the one or any AUDSs that you use for dispensing to outpatients to take home. And so that's why sometimes emergency room AUDSs require licensure. Not all require licensure, but those that they actually take the medication out and hand it to the patient to take home and appropriately labeled do require licensure. There are reasons for that, but I'm also interested in hearing from members of the public as to why an exemption would be made. I have really personally no problems with the exemption, but I'm sure that there were reasons why that was required to be a licensed. It is complicated. I can tell you in hospitals it's been more than 5 years ago now, it was still not widely understood that that needed to happen. So a lot of hospitals now do have their emergency room AUDS licensed.
Great. Thank you, Nicole.
Yeah, thank you so much, Maria. That was super helpful. I agree with the WATCH position. The one thing that's coming to mind for me on this one, and I'd love to find out as we get through this process, is that this might make it easier to dispense post-exposure prophylaxis, particularly for HIV to patients. I see a lot of patients coming out of an emergency room, and PEP is time sensitive. I see a lot of patients coming out of an emergency room and having a hard time filling it, especially on a weekend, late at night, things like that. So, and those bottles of the HIV medications used for the post-exposure prophylaxis are labeled that it cannot be dispensed outside of the container. So would this allow them to dispense the full bottle, which would be a course, to a patient? That would be something I'd be interested in learning as we go through this process.
Thank you, Nicole. Yep, that's a really good example. Maybe, I don't know if Maria has any experience with that, but.
I agree with Nicole's concern about, especially when it's a bottle that's labeled for one-time use, so that the patient needs it, and also eliminates the potential of waste. My concern, and another reason to watch this, is that unintended consequence could be that a physician says that my patient needs a 14-day supply of amoxicillin, for example. Therefore, I will give them, all the tablets out of the AUDS, and that's not an unused portion. That's a future dosing. So I think that's again going to the definition of unused portion. But Nicole's point is a good one, that those things that are patient specific that cannot be reused on another patient, I think is an area to discuss further, but not additional tablets that are like unit dose or things like that, just to say that they need to finish the course of therapy.
Okay, thank you. If there are no other comments from members, I think we're ready for public comment, and we'll start with the public in Sacramento.
Hello again, Michelle Rivas, CPHA. CPHA, we have a support if amended on AB 447. We agree with the concept of the legislation, but we expressed some of the same concerns with Board Member Serpa on some of the issues around labeling, et cetera. We also want to make sure that any dispensing that's done by a non-pharmacist, that they are held to the same vigorous standards that pharmacists are when dispensing those medications. The bill, as you said, was heard yesterday in committee. It did pass out with some amendments, so it does look like they're tightening up the bill a little bit, which will address some of our concerns. We're hoping that we get to a good place that we can move to a full support of the bill. Thank you.
Thank you very much for your comment. Any other members of the public in Sacramento? Great. Moderator, we are ready for public comment from individuals via WebEx.
Thank you. If anyone would like to make a comment, you can look for the hand icon, typically at the bottom of your computer WebEx screen. If you're on a mobile device, it might be behind the 3-dot other options button. And if you're a call-in user, you can press *3 to raise your hand. Each speaker will have 3 minutes with a 10-second warning, and we ask people to speak only once per agenda item. We will attempt to take the requests in order. And the first one is from Keith Yoshizuka. Keith, I'm sending you a request to unmute. And you're
Thank you very
unmuted.
much.
Go ahead.
Keith Yoshizuka, California Society of Health System Pharmacists. I support the comments made by Drs. Serpa and Thibault. I think they're valid. We would also support an amendment for the concept of having that ADDS exemption from licensure if the primary purpose is to provide medication not necessarily for discharge, but in specific cases, and that may have to be fleshed out a little bit. Also, the issue of labeling, existing law requires any prescription medications dispensed by a prescriber must meet the same labeling requirements as a pharmacy, except that it doesn't have a prescription number. And as Dr. Serpa mentioned, a lot of times this occurs, but the dispensing occurs, but not the labeling. And it may be that the bill may need to be amended to specifically point that out, not necessarily to duplicate the existing law, but as a reminder, because my fear is that people will look at just that one section, oh, we could do this, so they go ahead and give it out without the proper labeling. So maybe just as a reminder to mention it in the bill. Thank you.
Thank you very much for your comments.
And our next public commenter is Andre Peters. And Andre, I'm going to send you a request to unmute your mic, and you'll have 3 minutes with a 10-second warning. And you're unmuted. Go ahead.
Can you hear me okay?
Yes.
Thank you. Andre Peters, and I'm speaking in my personal capacity as a pharmacist. When we looked at, or when I looked at the proposed bill, we immediately identified that the AUDS licensing could be a potential barrier. And in speaking to colleagues, it immediately became apparent that if this bill passes and the AUDS is not exempt from licensure, it would present an unintended barrier to implementation at a lot of hospitals, because many PICs do not necessarily want to add another license to their pharmacy license under their responsibility. So I agree with the a line of thinking already expressed by a few of us that the AUDS license should be exempt. So if you could help us and support that amendment, that would be good. In general, the unused portion of a medication would be things like, let's say, eye ointment or eye drop is being used. Let's say the patient gets a treatment with an inhaler. So those are all multi-use. I think we have to be really careful about scope creep when we're now starting to include tablets and capsules and other things, basically opening up the ED to become another dispensary. I want to point out that these proposed new laws would definitely impact the pharmacy department. And if the pharmacy department is going to be involved in providing labels and creating new processes, it would be important. And going back to the AUDS, if we do not exempt from licensure, that the alternative would be for pharmacy departments to put these medications in cabinets and track it by paper, and that would basically put the practice of pharmacy back 40 years.
10 seconds.
So yeah, if I just want to make sure that this important point is raised.
Thank you very much for your comments.
And at this point, I do not see any other requests for comment online. Shall I close the public comment feature?
Yes, please.
Thank you.
Members, I'm going to bring the discussion back one more time to see if anyone has any additional comments after hearing public comment. No. Okay. Hearing none, I will bring it back for a roll call vote. Oh, did we have a motion?
No.
Oh, we
Just
didn't
gonna
have a
watch.
motion. Okay,
Okay.
just watch. Okay. Thank you. Moving on to the next item, members, we have Assembly Bill 529, which would extend the board's authority to continue to waive provisions of pharmacy law for up to 120 days following the termination of a declared emergency. The measure successfully passed out of Assembly Business and Professions Committee with 17 votes in support of the measure and 1 abstention. I agree with the staff recommendation to support the measure. Members, I welcome your thoughts on the measure and would also entertain a motion to recommend establishing a position on the measure if you believe such action is appropriate.
This is Nicole. I'll move to take a support position on this.
Great, thank you, Nicole.
I'll second.
Thank you, Maria. With a motion and a second on the floor, we can open it up for public comment in Sacramento. Seeing none, moderator, we're ready for public comment from individuals participating via WebEx.
This is the WebEx moderator, and we have opened up public comment. If you'd like to make a comment, you can click on the hand icon to raise your hand. We do have a raised hand from Keith Yoshizuka. And Keith, since we've opened up for a second time, we'll go ahead and send you a request to unmute.
Thank you. Keith Yoshizuka, California Society of Pharmacists and Pharmacists. I speak in favor of the proposal to support this bill. It has been a tremendous help, particularly during the wildfires, to serve the victims of those fires in those areas. Thank you very much.
Thank you very much for your comments.
And I do not see any further requests for comment. Shall I close that public comment feature?
Yes, please. Thank you. And I will now bring it back to the board for a roll call vote. Trevor, how do you vote?
Yes.
Thank you. Maria?
Yes.
Thank you. Nicole?
Yes.
Thank you. And I vote yes, the motion passes. Members, as amended, Assembly Bill 667 would, beginning July 1st, 2026, require boards within the DCA to permit an applicant who cannot read, speak, or write in English to use an interpreter at no cost to the applicant. The measure would specify that the interpreter cannot have a license for which the applicant is taking the examination and would require the board to post information regarding the provisions. It would also require boards to update applications to ask the applicant to identify their preferred language and require boards to conduct an annual review of the language preferences of applicants. Boards would be required to report this information annually to specified committees of the legislature as specified beginning January 1st, 2029. Members, I believe this is another measure that we should watch. The measure was considered in Assembly Business and Professions Committee yesterday, and it is my understanding that the measure passed out of committee with additional amendments to the measure. Those amendments are not yet in print, although it is my understanding that as amended, this provision may no longer apply to board licensees. Members, I welcome your thoughts on the measure.
Hi, Jesse. This is Maria. I found this a very interesting concept, and I'm really interested in public comment in this area. I don't think the board, since I've been on the board, that we've had this discussion about English proficiency. In the pharmacy community, in pharmacy organizations, this has been discussed quite at length over many, many years. And the concerns in the pharmacy community have always been about communication with the patient and being able to consult with the patient and provide consultation with the patient and to communicate with the patient about their medications. And the concern in the past has been that someone who is not proficient in English would have a difficult time having a discussion with the patient about their medications. Technology and things have changed, so that discussion may be different, but I'm looking forward to public comment.
Thank you, Maria. Any other comments from board members? Oh, sure. Go ahead, Ann.
Yeah, I think that one of the interesting pieces about this legislation is also the potential for exam compromise. And we've lived through that before. So just throwing that out as well.
Thank you, Ann. I will also add to that. I'm interested in that, and there are definitely communities within California where you really don't need to speak much English. But then my concern for as a healthcare provider is communicating with other healthcare providers. You know, if you ever have to call a pharmacy and get a transfer, or if you have to call doctor's offices for clarification, that may create some barriers. So I'm also interested in hearing public comment too. And if we have no other comments from members, we can open it up for public comment in Sacramento. Being none, moderator, we're ready for public comment from individuals via WebEx.
Thank you. This is the moderator. We've opened it for public comment for this bill. If you'd like to make a comment, you can click on the hand icon, or you can, if you're on a mobile device, it might be behind the 3-dot other options. And if you're a call-in user, you can press *3 to raise your hand. Are there any comments on this bill? I do not see any requests for comment. Shall I close that feature?
Yes, please. Thank you.
You're welcome.
I'll bring it back to the board one more time. Any other comments on this measure before we proceed? Members, the next measure for our consideration is AB 669, which would ensure 28 days of inpatient, intensive, outpatient, or partial hospitalization for substance use disorder treatment for patients. The measure would also prohibit insurers from requiring prior authorization for FDA-approved medication used to treat addiction that are deemed medically necessary by a doctor. The provisions would become effective January 1st, 2027. The measure will be considered during the April 22nd, 2025 Assembly Health Committee. I agree with the comments in the chair report that the board has historically supported measures that address barriers to access to treatment and the recommendation to establish a support position. Members, I welcome your thoughts on the measure and would also entertain a motion to recommend establishing a position if you believe such action is appropriate.
Yes, I agree with this and support Assemblymember Haney's continued advocacy on this front. We need to be continually looking at every possible opportunity for ways that we can address the opioid addiction crisis. And this seems like a pretty direct way to continue to do that. So I move that we establish a position of support on AB 669.
Great. Thank you so much, Trevor. Do we have a second?
This is Nicole. I'll second.
Great. Thank you, Nicole. With a motion and a second on the floor, we're ready for public comment for the public in Sacramento. And seeing none, moderator, we're ready for public comment from individuals via WebEx.
Thank you. We've opened the public comment feature. If you'd like to make a comment, you can raise your hand by clicking on the hand icon, and anonymous or call-in users can press *3 to raise their hands. We do have a request from Keith Yoshizuka. Keith, I'm going to send you a request to comment to unmute. Go
Thank
ahead.
you for the opportunity. Keith Yoshizuka, California Society of Health System Pharmacists. We speak in support of the motion to support this bill. I think it's important. Anything we can do to combat the opioid crisis. Thank you.
Thank you very much for your comment.
And I do not see any further requests to comment. Shall I close that feature?
Yes, please.
Thank you.
Thank you. And I'll bring it back to members for a roll call vote. Trevor, how do you vote?
Yes.
Thank you. Maria?
Yes.
Thank you. Nicole?
Yes.
Thank you. And I vote yes, the motion passes. Members, Assembly Bill 957 would prohibit a pharmacy from selling cigarettes or tobacco products. The policy goals of the measure appear consistent with the board's policy statement included in the meeting materials. Yesterday, the measure successfully passed out of the Assembly Business and Professions Committee. I agree with staff recommendation to support the measure and note that it is consistent with the board's sunset issue related to hormonal contraception. No, policy statement, sorry. Members, I welcome your thoughts on the measure and would also entertain a motion to recommend establishing a position if you believe such action is appropriate. Great. Well, I'll go ahead and make a motion to support this measure. Do we have any second?
Sorry, Jesse. I'll second.
It's okay. With a motion and a second on the floor, we're ready for public comment for participants in Sacramento or from the public in Sacramento. Thank you. We do have public comment here.
Hello, Michelle Rivas with CPHA. CPHA has a support position that's consistent with where the organization has been. We believe that we should help people be as healthy as possible. Pharmacists, as you know, provide assistance with smoking cessation. So we think this is a good public health measure. Thank you.
Great, thank you. Any additional public comment in Sacramento? Seeing none, moderator, we're ready for public comment from individuals via WebEx.
Thank you. This is the moderator. We've opened up the WebEx Q&A feed or hand raise feature. If you'd like to make a comment, you can raise your hand. We have a raised hand from Keith Yoshizuka. I'm going to send you your request to unmute. Go ahead.
Keith Yoshizuka, California Society of Health System Pharmacists. Speak in support of the motion to support this bill, which is very similar to the ordinance in the city and county of San Francisco, which prohibits sale of tobacco products in a pharmacy or a building containing a pharmacy. Thank you.
Thank you very much for your comment.
And our next request for comment is from Stephen Gray. Stephen, I'm going to send you a request to unmute, and you'll have 3 minutes with a 10-second warning. There you go. You're unmuted. Go ahead. And Stephen, we're not hearing you yet. And you may need to change your microphone input by clicking on the mute button on the drop down at the side. And just a moment, I'm going to open up the Q&A feature so that you can type your comment in. That would be a question mark at the bottom right of your WebEx screen. And Stephen, if we don't get something from you in a moment, we will be closing the public comment, but you may email the board with your comment if you choose. And it does appear that Stephen has lowered his hand.
Okay, I'm also okay with accepting his public comment later if he's not having technical issues. And it looks like we may have another public comment in Sacramento.
All right,
Thank you.
you're welcome.
I think the middle one. Oh, I think you may have shut it off, actually. Yeah, there you go.
Okay, rookie over here. Good morning, everyone. My name is John Cerny. I represent CVS Health. I'm a director of pharmacy, and I have the Northern California market. This is my first time here, so thank you for having me. I was actually not planning on commenting on this, but I did want to share with the committee, like, we fully support this. Obviously, CVS Health removed all tobacco products in over 10,000 stores. And what I'll share with this committee is that it has changed the landscape and environment of patients that come into our drugstores across the chain. And it does, potentiate our profession quite a bit. And I'll share with you folks, like, we have, walked away from $2 billion in sales, because of this. So it does have an impact on the overall financial health of the business. However, we see the shopping trends change, and healthcare and patients, come to our stores to find healthcare as opposed to, coming up front to buy, alcohol and tobacco. And then we did lean into, a lot of smoking cessation products that normally we wouldn't carry. So we are definitely in support of this, and we, feel like, all pharmacies in the state of California should consider, not selling tobacco products. Thank you.
Thank you so much. It's great to hear your perspective. And if there are no additional comments, we will bring it back to members for the roll call vote. Trevor, how do you vote?
Yes.
Thank you. Maria?
Yes.
Thank you. Nicole?
Yes.
Thank you. And I vote yes, the motion passes. Members, Assembly Bill 1037 would remove the January 1st, 2026 sunset date related to pharmacists' authority to furnish hypodermic needles and syringes for human use without a prescription under specified position. Yesterday, the measure was considered and passed by the Assembly Health Committee. I agree with the staff recommendation to support the measure. Members, I welcome your thoughts on the measure and would also entertain a motion to recommend establishing a position if you believe such action is appropriate.
This is Nicole. I'll move to take a support position.
Great, thank you, Nicole. Any seconds?
I'll second.
Great, thank you, Maria. With a motion and a second on the floor, we're ready for public comment in Sacramento. Seeing none, moderator, we're ready for public comment from individuals participating via WebEx.
Thank you. This is the moderator. If anyone would like to make a comment on this bill, you may click at the hand icon, and our call-in users may press *3 to raise their hands. We do have a request for comment from Keith Yoshizuka. I'm going to send you a request to unmute. Go ahead.
Yoshizuka, California Society of Health System Pharmacists. Finally, after 25 years of having this as a study, a demonstration project, I'm pleased to see that there's a bill introduced to make this permanent. This authority has been extended and extended. So I speak in favor of a motion of support for this bill. Thank you.
Thank you very much for your comments.
And I do not see any further requests for comment. Shall I close the public comment feature?
Yes, please. Thank you.
You're welcome.
And we'll bring it back to members for the roll call vote. Trevor?
Yes.
Thank you. Maria?
Yes.
Thank you. Nicole?
Yes.
Thank you. And I vote yes, the motion passes. Members, Assembly Bill 1460 would prohibit a prescription drug manufacturer from engaging in discriminatory practices that would impose additional conditions or otherwise interfere with a covered entity's purchase or delivery of a drug subject to federal pricing requirements under specified conditions. The measure will be discussed during the Assembly Health Committee on April 22nd, 2025. I agree with the staff recommendation to establish a support position. Members, I welcome your thoughts on this measure and would entertain a motion to recommend establishing a position if you believe such action is appropriate. Maria?
I move to support this position and add that we should be very concerned about programs or discussions that limit access to 340B programs that allow for cost-effective treatments of patients in California.
Great. Thank you, Maria.
This is Nicole, and I'll second that. And this is actually my area of expertise. So I echo what Maria said. I would like to flag, you're going to see, we're already seeing pharma coming out against this very strongly. You're going to hear some very disingenuous comments about the 340B program, but to be clear, it is a program that allows safety net providers to buy drugs at a discount and put the money they save back into patient care. The money is fully funded by the manufacturers. It basically comes out of their profit, which is why they don't like it. It is in no way taxpayer money. So when they are reducing access to this program, they are increasing costs to taxpayers and to people in general, and limiting access to these drugs at this discounted price. So this is super duper important, and happy to answer any questions if you all have any.
Thank you so much, Nicole. And I want to thank you for putting that so eloquently and concisely. I think it's a very complicated topic. And I think for the reasons you stated, you know, a lot of the time it's made out to be more complicated than it is, but you've just explained it so well and so easy to understand. So I'm looking forward to the discussion and hearing public comment on this.
Thank you.
If we don't have any other comments from members, we're ready for public comment for public members in Sacramento. Seeing none, moderator, we're ready for public comment for participants via WebEx.
Thank you. This is the moderator. If anyone would like to make a public comment, you can click on the hand icon at the bottom of your WebEx screen, or you may look for, our call-in users may press *3 to raise their hand. Each speaker will have 3 minutes with a 10-second warning. Our first comment is from Keith Yoshizuka. I'm sending you a request to unmute. Go ahead.
Thank you. Keith Yoshizuka, California Society of Health System Pharmacists. I agree that Dr. Thibault had explained that perfectly. I speak in support of a support position for this bill. As a former director of pharmacy of the St. Luke's Hospital in San Francisco's Mission District, I can tell you what a difference that these 340B drugs make to a hospital's budget. It was a struggle just to keep the hospital open, and this helped us a lot. Thank you very much.
Thank you very much for your comments.
And if I do not see any raised hands or requests for comment, so shall I close this public comment feature?
Yes, please. Thank you.
You're welcome.
Members, if there are no additional comments, we'll be taking the roll call vote. Trevor, how do you vote?
Yes.
Thank you. Maria?
Yes.
Thank you. Nicole?
Yes.
Thank you. And I vote yes, the motion passes. Members, Assembly Bill 1503 is the board's sunset measure. In its current form, the measure would update the term advanced practice pharmacist to advanced pharmacist practitioner. I agree with the recommendation to establish a support position. Members, I welcome your thoughts on the measure and would also entertain a motion to recommend establishing a position on the measure if you believe such action is appropriate.
I move to accept the support position and look forward to the discussion tomorrow.
Great. Thank you, Maria. And I will second Maria's motion. So with a motion and a second on the floor, we're ready for public comment for participants in Sacramento. Being none, moderator, we're ready for public comment via WebEx.
And this is the moderator. If anyone would like to make a comment on the sunset bill, you may click on the hand icon to raise your hand, and our calling users could press *3 to raise their hands. We do have a request for comment from Keith Yoshizuka. I'll send you a request.
Thank you. Keith Yoshizuka, California Society of Health System Pharmacist, and I speak in support of this bill. Thank you.
Thank you, Dr. Yoshizuka.
And I do not see any further requests for comment. Shall I close the public comment feature?
Yes, please. Thank you.
You're welcome.
Members, we're ready for a roll call vote. Trevor?
Yes.
Thank you, Maria.
Yes.
Thank you, Nicole. Thank you, and I vote yes, the measure passes, or the motion passes rather. Members, as amended, Senate Bill 41 would establish the regulation of pharmacy benefits managers, also referred to as PBMs, within the Department of Insurance. The measure will be considered on April 23rd by the Senate Health Committee. As the meeting materials note, the board has received public comments and complaints from consumers and healthcare providers stemming from actions by PBMs. This measure is similar to Senate Bill 966 from last year that was supported by the board but was vetoed by the governor. I agree with the recommendation to establish a support position. Members, I welcome your thoughts on the measure and would also entertain a motion if you believe such action is appropriate.
Yes, strongly support this as we did last year. PBM reform is something that's an existential threat to pharmacies across the state as far as reimbursements rates, and we desperately need reform on this. So a strong supporter of Senator Wiener's SB 41, and I hope that with our new legislative capacity on the board, we can effectively communicate again to the legislature as well as to the governor's office about why this is so important for the health of our regulated public and pharmacies across the state. So I move to support SB 41.
Thank you very much, Trevor. And I will second Trevor's motion. So with a motion and a second on the floor, we're ready for public comment in Sacramento. And we do have public comment here.
Michelle Rivas, CPHA. CPHA is proud to co-sponsor this legislation again, and we respectfully request the support of the board. I think having your voice as the individuals whose number one priority is patient protection is really important in these discussions. We believe that the legislature overall will continue to be supportive. A few years ago, talking about PBMs, people's eyes would kind of glaze over. Now everybody understands the impacts because everybody has been affected by the unfair business practices of some PBMs. We want to be clear, they aren't all bad and we recognize that, but of some PBMs. So again, having your voice supporting this legislation would be very helpful. We have had a number of discussions with the Health Committee. The chair is committed to making sure that we are able to provide true patient protection and make sure that they benefit financially from this legislation. So again, we respectfully request the board's active support of this legislation. Thank you.
Thank you very much for your comments.
Thank you.
Do we have any additional public comment in Sacramento? Okay, seeing none, moderator, we're ready for public comment via WebEx.
Thank you. This is the moderator. If anyone would like to make a comment on this bill, you may look for the hand icon and click that to raise your hand. Our call-in users may press *3 to raise their hands. We do have a request for comment from Keith Yoshizuka. Keith, I'm sending you your request to unmute.
Keith
Go ahead.
Yoshizuka, California Society of Health System Pharmacists. We speak in support of the support position for this bill. Thank you.
Thank you, Dr. Yoshizuka.
And we have another request for comment from Anna Chapiran and Chaparian. I'm going to send you a request, unmute your microphone, and you'll have 3 minutes with a 10-second warning. Go ahead.
And I'm in great support of this bill. And I echo what Michelle Rivas said. Thank you.
Thank you for your comments.
And I do not see any further requests for comment. Shall I close that public comment feature?
Yes, please. Thank you.
You're welcome.
Bringing it back to members for the roll call vote. Trevor, how do you vote?
Yes.
Thank you. Maria?
Yes.
Thank you. Nicole?
I have to abstain on this one.
Okay. Thank you. I vote yes. The motion passes. Members, Senate Bill 470 would make the current flexibilities provided in the Bagley-Keene Open Meetings Act permanent. The board has relied upon the current flexibilities under the temporary provisions. I agree with the recommendation to establish a support position, and I note that establishing such a position would be consistent with the board's position last year on a similar measure. The measure passed out of the Senate Judiciary Committee yesterday. Members, I welcome your thoughts on this measure, and I would also entertain a motion if you think it's appropriate. I'll also add that this provides so much flexibility, I think, for a lot of people, but you know, a lot of life happens, and I would love to see this passed. Members, any comments?
Hey, Jesse, it's Nicole. This is particularly important for me. This is what allows me to participate in the board as a chronically ill and disabled person. And I think it's really important in a state like California that we don't stop someone from participating just because they can't physically go to a location. So I strongly support and would like to make the motion to move to support.
Great. Thank you, Nicole.
I second.
Thank you, Maria. With a motion and a second, we're ready for public comment in Sacramento. Seeing none, moderator, we're ready for public comment via WebEx.
Thank you. If anyone on WebEx would like to make a comment on this motion, you may look for the hand icon and click that to raise your hand. Our calling users can press *3 to raise their hands. Are there any comments on the motion? I do not see any requests for comment. Shall I close that feature?
Yes, please.
Thank you.
Thank you. Bringing it back to the board for a roll call vote. Trevor, how do you vote?
Yes.
Thank you. Maria?
Yes.
Thank you. Nicole?
Yes.
Thank you. And I vote yes, the motion passes. Members, Senate Bill 497 would prohibit release of medical information related to a person seeking or obtaining gender-affirming healthcare or gender-affirming mental health care under specified conditions. Yesterday, the measure passed out of the Senate Judiciary Committee's hearing on April 8th. I agree with the recommendation to establish a support position. Members, I welcome your thoughts on the measure and would entertain a motion if you think such action is appropriate. Okay, I will just add, personally, I have a lot of friends, patients, and colleagues who are very afraid right now, and I think it's important that we show our support, really put a firm stance on these issues, and do what we can to protect everyone here in California from whatever horrors may be happening down the line. So if we don't have, oh, Trevor, go ahead.
God damn. Excuse me.
Bad timing.
Yeah, I know, really bad timing. Just to reiterate that the board has a long history of standing strongly with gender affirming care, standing strongly with the transgender community, as does Senator Wiener, who I'm proud to call my state senator. And again, given the troubling dynamics of attacks on the trans community across the country, this is another opportunity for the state of California to establish itself as a leader in protecting this necessary and essential care. So I move to, sorry, what bill number? Yes, I move to
497.
support Senate Bill 497.
Thank you, Trevor.
This is Nicole. I'll reiterate what you all said. This is super important to our patients having access to gender affirming care. There's a lot of fear right now about what's going to happen, what access is going to look like. There's also fear that if our patients travel to another state, that they're going to run into issues, even if they're seeking care for something unrelated to their gender affirming care. So I would like to second this motion. One thing I would flag here is, and I don't know if there's anything that this bill can do about it, but in our own state of California, our Medi-Cal program requires us to use a diagnosis code of gender dysphoria for gender affirming care, which essentially flags that it's for someone who's trans as opposed to just, hormonal intervention. So I would love to see that changed. It's something we've flagged for Medi-Cal, but I would love that to maybe become part of this bill or happen so that it doesn't have to flag someone when they're just seeking, hormonal treatment.
Great, thank you so much, Nicole. And do you know if we can provide the sort of notes to the author's office?
Yeah, absolutely. As part of our letter of, conveying the board's position, we can include that as part of the, yeah.
Great, thank you so much. That
Thank
is
you.
some wonderful insight, Nicole. Thank you. We are ready for public comment in Sacramento. Being none, moderator, we're ready for public comment from individuals participating via WebEx.
Thank you. We've opened up the public comment features. If you would like to make a comment on this bill, you may look for the hand icon, and our call-in users may press *3 to raise their hand. We do have a request for comment from Keith Yoshizuka. I'm going to send you your request to unmute. Go ahead.
Thank you. Keith Yoshizuka, California Society of Health System Pharmacists. We speak in support of the support motion, in particular, the protections it affords practitioners in this state from subpoenas from other states where the activities may be unlawful, as well as protections from law enforcement from forces from outside the state seeking to detain California practitioners from doing what's lawful in this state. Thank you.
Thank you for your comments.
And are there any other requests for comment on this bill? I do not see any other requests for comment. Shall I close that public comment feature?
Yes, please. Thank you.
You're welcome.
Members, I'll bring it back to us for a roll call vote. Trevor, how do you vote?
Yes.
Thank you. Maria?
Yes.
Thank you. Nicole?
Yes.
Thank you. And I vote yes, the motion passes. Members, Senate Bill 548 would require the California Health and Human Services Agency on or before January 1st, 2028, to create a set of recommendations to support a 5-year implementation plan for reducing alcohol and drug-related addiction deaths by 50% by 2031, and convene a state advisory group for the purposes of advising the agency on those recommendations. The bill would require the advisory group to consist of representatives from specified entities, including the State Department of Healthcare Services, among others. The bill would also require the agency to adopt the recommendations provided by the advisory group and to consider specified information, including quality and performance measures, in establishing minimum standards for the effective delivery of services. I note that the staff are recommending a support position. The measure will be considered by the Senate Health Committee on April 30th, 2025. Members, I welcome your thoughts on the measure and it would entertain a moment if you think such action is appropriate. Maria?
Before making a motion, I wanted to make a couple of comments. I do appreciate that the staff pointed out that that the board or a pharmacist is not included in the advisory group that's recommended to be convened. And in light of, we've had several really very good presentations over the last few months regarding opioid use disorder, overdoses, and access, that I think that a pharmacist voice in this committee or in this advisory group would be really important to deal with the access issues and those kinds of concerns which may not be addressed in the same manner by other healthcare practitioners. With that said, I move to support and would suggest that either the letter include that, or I don't want to say support if amended because I think we do support the concept overall.
Great, thank you, Maria. I agree with that as well. I think having the pharmacist there is really bridging a gap. You know, as we heard from some emergency room providers, a lot of the barriers, it seems, are from the pharmacy level. And so having pharmacists participate in that advisory group would be wonderful if they're amenable to that change. But I agree, and I will second your motion. So any other comments from members? Okay, if not, we will open it up for public comment starting in Sacramento. Seeing none, moderator, we're open for, we can open it for public comment via WebEx.
Thank you. We've opened up the hand raise feature. If anyone would like to make a comment on this bill, you may look for the hand icon at the bottom of your WebEx screen. And if you are a calling user, you may press *3 to raise your hand. We do have a request to comment from Keith Yoshizuka. Keith, I'm sending you another request to unmute. Go ahead.
Thank you very much. Keith Yoshizuka, California Society of Health System Pharmacists. I speak in support of the support position. We support Dr. Serba's comments about having a pharmacist on the team. We as well would like to see a pharmacist on that panel, particularly one that's knowledgeable in the area of substance use disorder. And if need be, we would be more than willing to suggest nominations for people with that background. Thank you.
Thank you, Dr. Yoshizuka.
And at this time, I do not see any further requests for comment. Shall I close that public comment feature?
Yes, please. Thank you.
You're welcome.
Members, we're ready for the roll call vote. Trevor, how do you vote?
Yes.
Thank you. Maria, how do you vote?
Yes.
Thank you. Nicole?
Yes.
Thank you. And I vote yes, the motion passes. Members, Senate Bill 647 would authorize the boards within DCA to waive the application of certain provisions of board licensure requirements for licensees and applicants impacted by a declared federal, state, or local emergency, or whose home or business is located in a declared disaster area, including certain examination fee, and continuing education requirements. Additionally, it would require all applicants and licensees of the board to provide the board with an email address. I note that should this measure be enacted, the board will be required to pursue a regulation change related to maintaining an email address with the board. Additionally, I note that the board would anticipate a decline in revenue. I note that the staff are recommending a support position. Earlier this week, the measure successfully passed out of the Senate Business and Professions and Economic Development Committee with 10 votes in support of the measure and 1 abstention. Members, I welcome your thoughts and would entertain a motion if you believe such action is appropriate.
This is Nicole. I'll move to take a support position.
Thank you, Nicole.
I'll second.
Thank you, Maria. We're ready for public comment in Sacramento. Seeing none, moderator, we're ready for public comment for individuals via WebEx.
Thank you. This is the moderator. We've opened up the hand raise feature for public comment. If you'd like to make a comment on the bill or the motion, you may look for the hand icon at the bottom of your WebEx screen, or you may, if you're a call-in user, you may press *3 to raise your hand. Are there any comments on the bill or the motion? I do not see any requests for comment. Shall I close that feature?
Yes, please. Thank you.
You're welcome.
And we'll bring it back to members for the roll call vote. Trevor?
Yes.
Thank you. Maria?
Yes.
Thank you. Nicole?
Yes.
Thank you. And I vote yes, the motion passes. Members, all the items included in the regulations portion of the report are for information only. As detailed in the meeting materials and associated attachments, the board has several regulations in various stages of promulgation. I do not intend to review each item individually, as the information is contained in the public materials. The board has one regulation undergoing post-adoption review by the Office of Administrative Law, 2 regulations undergoing pre-notice review, and staff are preparing regulation document for the ADDS self-assessment rulemaking package and revising the rulemaking package for the board's outsourcing facility proposal. Members, do you have any questions or comments on the regulations? Maria?
Yes, I just have one comment on item 2 on the outsourcing facilities. My concern is about the self-assessment that is still undergoing review. And I'm hoping that dependent upon the results of the sunset review bill, that we can move ahead and finalize that self-assessment form for outsourcers. The board approved it back in 2022, and I understand OAL had some questions last year. So I just wanted to bring that up so that it's at the forefront of our discussions.
Great. Thank you, Maria. Any additional comments? Okay.
This is Nicole. Just wanted to say I'm excited about digital signatures. That's going to be great.
Thank you, Nicole. Okay. And it looks like we're ready for public comment for individuals in Sacramento. Seeing none, moderator, we're ready for public comment from individuals via WebEx.
Thank you. This is the moderator. If anyone has a comment on the issue, you may look for the hand icon and click that to raise your hand. We ask that each person speak only once per agenda item. You'll have 3 minutes with a 10-second warning. Any comments on the concept? I do not see any requests for comment. Shall I close that feature?
Yes, please. Thank you.
You're welcome.
Before we adjourn today, I would like to thank everyone for your time and participation. Our next meeting is proposed for scheduling on June 11th, 2025. Please watch the website for updates on this meeting. I look forward to seeing everyone later this month at the board meeting. Well, later today. Thank you, everyone.